Hey guys, Dr. Christine Vaccaro, urogynecologist and sexual medicine specialist in the DC area. And I'm going to be talking to you about pain control for IUD placement. Now, this has been a hot topic lately, and I'm glad it is because it's raised more awareness of how we can aid in making a procedure that has so many benefits a little bit more pleasant for patients. So, I'm going to be using this guide just to kind of talk through and walk through all the places and spaces that we can help with comfort during placement of an IUD. So the first thing is the cervix. The cervix generally needs to be a little bit soft, so options for that are what's called Cytotec, which softens the cervix. That can be given either nightly or nightly and the morning of the procedure, especially in women that have never had a baby or have had difficulty with placement before or are postmenopausal. Another nice thing, if possible, is to come when on your menstrual cycle. So if you are still having menstrual cycles, when you're actually bleeding, the cervical opening is a little bit more open, so it allows it to pass a little bit easier. Other things that we can do are giving ibuprofen, which is like Motrin or Advil. That helps reduce any cramping that's going to happen after placement. So the uterus initially doesn't quite like that there's a new foreign body in a space there, and so giving that before the procedure helps kind of reduce the cramping and irritation with placement of the device. Other things that I think are helpful are a paracervical block. That's where we block the cervix so that we're passing it through this kind of narrow passageway, that it's not as uncomfortable as it would be without a paracervical block. The block is usually like a lidocaine or a Marcaine, which basically just is a numbing medication for the area. And lastly, certainly for patients that have a little bit of anxiety with procedures and just for their patient for comfort, you can give oral Valium. In our office, we also have the ability to give nitrous gas just to help provide a little bit of relaxation for the procedure. So all of these are on offer and are certainly something that you can advocate for your IUD procedure.